Welcome to this VetVine Buzz segment. I'm here with Dr. Matthew Cornea. He's here, one of our VetVine members, this week talking about a paper that he's first author with some other distinguished VetVine members and co-authors. Dr. Cornea, welcome.
Hi there.
Talk to us about your paper, please.
All right, so I'm here to talk about the association between oral health status and retrovirus test results in cats. So for a little background, when we talk about feline retroviruses, which are endemic worldwide, we're referring mainly to FIV, the feline immunodeficiency virus, and FELV, the feline leukemia virus. There are others, but they're not really of clinical significance. FIV in particular, its main prevalence is in intact male cats. It's acquired from bite wounds, deep bite wounds. They need to really draw blood. These infected animals seroconvert in about 3 to 6 weeks and then remain antibody positive for life. We don't really have a good antigen test available for these guys. Post-infection, these guys either present to a clinic as healthy animals or as sick cats. Immediately post-infection, we're looking at these acute clinical signs characterized by these flu-like symptoms: mild transient fever, lethargy, malaise. Afterwards, they go into a subclinical phase that can last months, even years. It's not really well defined. During this time period, they're healthy to all external appearance. However, their immunocompetence is slowly waning. They're getting a CD4 T lymphopenia, neutropenias, occasionally hyperglobulinemias from a compensatory B-cell response, but they're also getting multi-organ involvement here: encephalopathy, enteritis, neuropathy, and what we're really looking at here today, stomatitis and other oral cavity disease. In the final phase of disease, which can be years after initial infection, we see this feline AIDS or FAIDS syndrome. This is characterized by opportunistic infections, severe neurologic disease, or neoplasia, and can, in many cases, be fatal. FELV, on the other hand, is a quite different disease. It's transmitted through shared saliva. So this is shared food and water bowls, sneezing, grooming, biting, occasionally vertical transmission to an extent. Post-infection, we have a huge range of outcomes for this disease, dependent on the viral subtype, the age the cats are infected at, and the immune response the individual animal mounts. Invariably, regardless of which of these occurs, the disease is fatal, either due to neoplasias, classically lymphomas, but also leukemias, myelosuppressions with anemias, immunosuppressions, even neurologic disease, a whole range of very unpleasant symptoms. The other part of what we're talking about today is inflammatory oral disease. This is an incredibly complex and multifactorial process. It involves immune responses, infectious agents, classically FHV1, but also calicivirus, other innate bacterial flora of the oral cavity. It can be localized to a single area. It can be widespread throughout the entire mouth. This often involves some degree of ulceration, but doesn't necessarily have to. So the objectives of this study were to determine the association between oral health status of cats and seropositivity for FIV or FELV. You know, it's pretty widely accepted that there is some degree of correlation, but it hasn't really been characterized what that degree of correlation is, and then how that differs depending on type of oral disease, type of retrovirus, that kind of thing. So we basically stratified our oral diseases into gingivitis, periodontitis, and stomatitis, and then looked at the correlation with those factors with age, gender, and retrovirus positivity of the animals. To get this data, we did a cross-sectional survey, sent out surveys to a wide range of veterinary clinics and shelters across North America, got responses back from 125 clinics and 25 shelters. The veterinarians participating had to perform some brief online training on how to classify oral disease, just to make sure we had some degree of standardization to things. They then had to fill out records involving the age and sex of the cats, oral health score, and then their retrovirus status on the ELISA test. We chose not to confirm these with more in-depth testing, just based on the number of cats we were dealing with and issues of practicality. The only real excluding factor to this was that these cats could not have any history of FIV vaccination, because that obviously interferes with testing. So we got 5,179 cats enrolled in the study with a mean age of 3.6 years, which you can see is quite low, and we had a significant left shift to this data. Our results: FIV positivity about 4.6% of animals, FELV about 3.6%, dual positivity about 0.2%. We didn't consider those dual positive animals separate from the other two groups. There just weren't enough of them to make any kind of conclusions based on the statistics. These prevalence numbers are fairly similar to what other studies have found, maybe a little bit higher, but within kind of a margin of error there. Looking at oral disease, overall, 40.6% of cats had some degree of oral disease. Now, that probably seems a bit low. I mean, a lot of other data says up to 75, 85% of cats have some degree of oral disease. That's because probably of the low age of cats we were sampling. A lot of people testing cats for retroviruses are testing kittens at their first appointments. We don't see that wide range of oral disease in our 6-month, even 6-week-old kittens. We did stratify everything by age to try and take that into account, but that's why we have such a low positivity of retrovirus disease. Breaking that down, 20% had gingivitis, 11% had periodontitis, about 4% stomatitis, and about 5% other oral disease, be that odontoclastic resorptive lesions, neoplasia, anything like that. Again, looks low, probably because of the young age of the cats. This is just a quick diagram here looking at some of the things we'd be classifying. Figure A being gingivitis, fairly mild gingivitis, B being non-specific periodontal disease, and then C there being widespread stomatitis. Important thing to remember, this is classification on physical exam by a general practitioner. There's no periodontal probing, no dental radiographs, and these aren't dentists. I realize that, in reality, the AVDC scheme has like 26 classifications of oral disease. This is meant to be something a general practitioner is going to do on physical exam, not something that's going to require anesthesia and dental x-rays and all that kind of thing. So the results of this. Inflammatory oral disease is associated with a significantly higher odds ratio of positive FIV test results. This is compared with the seropositivity risk for no oral disease or for the other category of oral disease. There's a lot of trends within this data and things, but for the most part, cats with inflammatory oral disease are more likely to be FIV positive and FELV positive than cats without. The other thing to take away from this is that we have increased odds of positivity in younger cats compared to older cats. Thinking about this, it kind of makes intuitive sense. If we see a 6-month-old kitten with severe stomatitis, that kitten is more likely to be FIV or FELV positive than our 10-year-old cat with stomatitis. These older cats, once we get above 10, we don't really see any correlation anymore. But the younger they are and the more severe or widespread the oral disease, the more correlation. So 6-month-old with stomatitis, more than a 6-month-old with gingivitis, more than a 10-year-old with gingivitis. That kind of makes sense. So conclusions here, inflammatory oral disease in cats has an increased risk of retroviral seropositivity. This means that retroviral testing should be conducted in cats with oral inflammatory disease. There's a lot of clinical relevance to this, partially in terms of selecting what cats to test. Despite recommendations on testing all cats in shelter situations and, certain clinic situations, that's just not practical to do. And looking at those cats that are younger with more severe oral disease, these are ones who should take top priority for testing for FIV and FELV. Clinical implications, it sounds redundant in this day and age, but cleaning and disinfection of dental equipment. When we're looking at up to 20% of cats that are young with stomatitis having FELV infections, the risk of nosocomial transfer of FELV or FIV during dental cleanings is humongous if we're not cleaning these well. They're not very stable viruses, they're quite labile in most solutions, but just making sure we do have that degree of sterilization. And then even looking at things like these cats with severe stomatitis, FIV testing these guys. They might not need a full mouth extraction. We might not need to do the $1,000 procedure to pull out all their teeth. If they're FIV positive, antiretroviral therapy has been shown to have great effects in these guys. And a course of AZT is significantly cheaper and easier on the animal than full mouth extractions are. That's basically all I had to talk about today. So thank you for listening.
That's what's buzzing this week. Thank you, Doctor.